So my name is Charlene Barrientos Ortiz, and I am a community engagement manager. So I work in health research and behavioral health research there at the university, but I work throughout the state with marginalized and communities and underserved communities. So I began my public health career really early on, but it was really when the HIV epidemic hit Denver. It hit close to home, and I had family members who were infected, and there was a lot of stigma and a lot of shame put for those folks who were impacted and infected. People needed to talk about it, and we needed to really work towards healing. So this was in the 80s, mid and late 80s. Folks were ostracized not only from their communities, but from their families. I know that in people of color communities, in Native communities, indigenous communities, and in the Latino community and in the Black community, our communities were harder hit, and sometimes it was harder to talk about it. In terms of community engagement, it was really ensuring that people were at the table, and when they couldn't be, how do we change that? My brothers and of color, the men of color, really struggled, and some of the time it was easier for me as a woman of color to sit at the tables than it was for them. So there was that internal racism even within the community. The way that research interprets data, the way that data is collected for our communities, and the way that it's disseminated isn't always culturally responsive to our communities. And depending on who collects that, and really, we have a lot of work to do in research. But when we really talk about families and those numbers that people see, they represent women and families and people that are connected, especially for our communities. When we talk about these topics and we talk about who's marginalized and who's missing, COVID really showed the racism and the discrimination that was already there. We're looking to see what we can share for folks. We're not there to tell them what to do. We'd love for people to get vaccinated so that we can go back and enjoy our families and be together. Really looking at protecting our families, protecting our children, and really starting with the elders and what that looked like. We lost so many people to COVID. So people in the community would call me a healer. They would call me a curandera. I identify as somebody who prays with my community and prays with my people. And that doesn't just mean Latinos. It is generational. My mom was indigenous, my grandma, they were really rooted in spirituality and religion. But there is this other level of energy and love. If people would just tap into that, when you pray with people and I support them, I guide them, and I facilitate their healing with them, we co-create that. It connects us to the future and it connects us to the past. We have a lot of work, but I'm hopeful. And this community engagement, as we call it now, it is really just making sure that our communities are, that they're involved and included and are part of the decision-making power. It's not just showing up. It's just not asking the medical community to show up. They need to listen. They need to create policies to change what that looks like. They need to hire people who look like us to do the work, and they need to support pipeline issues and making sure that people get the education to do the work.